Right now, you are sharing a space with something invisible. A dusty garage corner, an old cabin attic, a storage shed you haven't opened in years. One handful of that dust entering your lungs, and your body becomes a war zone within 48 hours. We live in 2026. We've sent rovers to Mars. AI writes research papers. And yet a virus that kills with a single breath is still out there. It's called Hantavirus, and the name itself was born in Korea. Today, 3 things. How this virus was discovered, the outbreak happening right now in the Atlantic, and why 50 years later we still haven't beaten it. By the end of this video, you will never sweep dust the same way again. The Korean Peninsula, war. But inside that hell, another terror appeared. No name, no cause, just death. Soldiers spiked fevers out of nowhere. Then came the bleeding from everywhere. Kidneys shut down, and then they died. From 1951 through the armistice, this disease swept through UN forces near the Hantan River. 200 infected. American military medicine was in full panic. Plague, typhoid, something brand new? The world's best doctors came in. Nobody had answers. They called it Korean hemorrhagic fever, 'cause unknown. No treatment. A death sentence. When the war ended, the disease didn't leave. People kept falling sick every year. In fields, in rural areas, wherever rodents lived. Not the Americans. Not the Soviets. Not the Japanese. Nobody knew why. 25 years later, a field along the Hantan River, Korea. A man was trapping wild striped field mice. Dr. Wang Lee, microbiologist. Korea University College of Medicine. For decades, US-funded research teams from around the world had tried and failed. Team after team, country after country, all gave up. Dr. Lee didn't. He focused on the lung tissue of those mice. Using immunofluorescence, he proved that mouse lung antigens reacted with antibodies from Korean War survivors' blood. The killer that struck those soldiers 25 years ago had been hiding inside these mice the whole time. The answer that the world's superpowers couldn't find was found by a scientist from a developing country. Most of the world had barely heard of. He named it after the river where the mice were caught. The Hantan River Hantavirus, today's Hantavirus. And he didn't stop there. 1980 discovered the sole virus in city rats. 1990 developed the world's first hantavirus vaccine, Hantavax. One man, one discovery, one diagnostic method, one vaccine. In 1986, the WHO officially recognized Hantavirus as a new genus, based entirely on his work. A Korean name permanently written into every medical textbook on Earth. Hantavirus is not one single virus. Think of it as 2 completely different monsters sharing the same name. The old world strain. Korea, Europe, Asia attacks your kidneys. High fever, bleeding, kidney failure. Fatality rate 5 to 15%. Most people survive with treatment. The New World strains the US and Latin America. That's where it gets terrifying. Hantavirus pulmonary syndrome. HPS. These go straight for your lungs and heart. It starts like a cold. Fever, muscle aches, fatigue. You think, I'll sleep it off. Then your lungs fill with fluid. Your heart starts to fail. Fatality rate 30 to 50%. Flip a coin. Heads you live. Tails you die. And the speed from first symptoms to critical condition 48 hours. No time to react. No FDA-approved treatment. All doctors can do is manage symptoms and hope your body holds on. May 2026, health agencies worldwide are on high alert. The MV Hondius, a Dutch expedition cruise ship. April 1st, 2026. Departed Ushuaia, Argentina. Destination Antarctic expedition, then north across the Atlantic. April 11th, 10 days in. A 70-year-old Dutch passenger collapsed. Fever, headache, stomach pain. The ship's doctor thought food poisoning. His condition spiraled fast. He died on board. April 24th, docked at St. Helena. His wife collapsed. Airlifted to Johannesburg. Dead on arrival, April 26th. Both confirmed hantavirus by PCR test after death. More cases followed. April 27th, British passenger. Pneumonia symptoms. Airlifted to Africa. Currently in ICU. May 2nd, German passenger dies on board. Switzerland confirms additional cases among disembarked passengers. As of May 9th, WHO reports 9 suspected and confirmed cases. 3 dead. The culprit Andes virus. The only hantavirus strain known to spread person to person. The ship is anchored near Cape Verde. 147 passengers and crew. Health agencies across multiple continents are tracking down everyone who disembarked. In the US alone, 5 states monitoring exposed passengers: Arizona, California, Georgia, Virginia, Texas. CDC has classified this as a level 3 emergency response. Hantavirus normally spreads through dried rodent droppings, microscopic dust. You breathe in, you don't need to touch the mouse. Just the dust it walked through is enough. But the Andes virus is different. It's the only hantavirus capable of human-to-human transmission. Close, sustained contact spouses, caregivers, medical staff can spread it. A sealed ship, dozens of people in shared cabins, shared dining rooms, shared air, worst possible conditions. WHO says the pandemic risk remains low. Airborne transmission has not been confirmed. But low risk is not zero. And viruses have a long history of defying our expectations. COVID-19 hit, and we had a vaccine in under a year. Fastest in history. Hantavirus has existed for 50 years. Up to 50% fatality. No cure. Why no vaccine? The answer is brutal. Hantavirus primarily kills farmers, soldiers and rural workers in developing countries. Run the math like a pharmaceutical company. Spend billions on trials, billions more on manufacturing. And at the end, not enough buyers to turn a profit. No profit, no investment, no development. With COVID, every person on Earth was a potential customer. With Hantavirus, the victims are poor, rural, and in the wrong countries. That is the humanitarian tragedy. The value of a human life ranked by market demand. But the Hondius outbreak is changing that. Hantavirus just killed European cruise travelers. Just put a British tourist in the ICU. Now it's everyone's problem. The pharmaceutical industry is paying attention. There's one more variable making this worse. As the planet warms, rodent habitats are shifting, pushing into suburban areas, closer to people. Rodent food supplies fluctuate with climate. In boom years, populations explode. More rodents, more virus, more risk. The Hondius passengers explored Argentina, Patagonia, southern Chile. Experts believe they were exposed to the Andes virus during a shore excursion. That small encounter amplified inside a sealed ship. Climate change is about the collision between human and wild animal territory. Every time that boundary shrinks, viruses find new hosts. Scientists call this spillover. When a pathogen leaps from wildlife into people, COVID-19, Ebola, Hantavirus, all spillover events. As we push deeper into wild spaces, this will keep happening. But here's where the story turns. The mRNA technology behind COVID vaccines is now aimed at Hantavirus. September 2023, the Vaccine Innovation Center at Korea University, Dr. Lee's own university partnered with Moderna. His legacy carried forward. February 2025. Animal trials confirmed the vaccine prevented infection. May 2026, right as the Hondius outbreak made global headlines, Moderna announced positive phase 1 clinical results for its mRNA hantavirus vaccine. No serious side effects. Strong antibody response across all doses. After 50 years, a real vaccine is within reach. Phase 2 and Phase 3 trials still lie ahead. But COVID showed us when the world focuses its attention, timelines compress fast. And the Hondius outbreak may be exactly the event that forces that focus. Let's get practical. This could save your life. Never sweep a space where rodents have been with a broom. That kicks contaminated dust directly into your lungs. Soak the area with bleach solution, 1 part bleach to 10 parts water. Let it sit. Wipe it up wet. Wear an N95 minimum. A cloth or surgical mask won't protect you. Outdoors, avoid spaces with rodent droppings, gnaw marks, or nesting material. If you must remove a dead rodent, do not hit or crush it. Use gloves, a mask, and a sealed bag. Disinfect everything it touched. For viewers in the American Southwest and rural South, Arizona, New Mexico, Texas, Colorado, California, the CDC tracked 890 U.S. cases between 1993 and 2023, with a 35% fatality rate. If you live or work near fields, ranches, or undeveloped land, you are in a higher risk zone. For our Hispanic community, agricultural workers, construction crews, anyone working close to the land, share this with your coworkers and your familia. This disease has historically hit hardest in communities that don't always get this information first. Protégete. Protege a tu familia. After any outdoor activity, if you develop sudden high fever, severe muscle aches, and decreased urination within 2 to 8 weeks, go to the ER. Tell them, I may have been exposed to hantavirus. Early detection saves lives. From a Korean battlefield in 1950 to one scientist, trapping mice in 1976 to a cruise ship in the Atlantic in 2026, The Hantavirus story is several stories in one. Science, one man's determination, the dark logic of capitalism, climate change, and finally hope. Dr. Wang Lee trapped mice along the Hantan River with nothing but determination. Today, that same university is partnered with Moderna to finish what he started. When we refuse to give up, we find answers. That is science. That is humanity. If this gave you something, hit like, subscribe, and share it with someone who needs to know. I'm Jarvis the Storyteller. Thank you for watching.